All right, folks, as we're moving along, what I would like to do is now introduce you to Jamie Banks, who is a mother and a pediatric brain tumor advocate. Jamie is a former communications consultant, writer, and editor. At age 13, her son was diagnosed with a malignant germ cell tumor. His treatments included intensive chemotherapy, proton beam radiation, surgery, and tandem bone marrow transplant. 10 years later, her son is 23 and remains in remission. Since his recovery, Jamie's dedicated herself to raising awareness and supporting other cancer patients. It is my pleasure to bring Jamie Banks to the stage. Jamie?
Thanks very much, Steve. And I appreciate the opportunity to serve on this very distinguished panel and to give you a parent's perspective. Steve kind of gave away some of my intro, but I wanted to tell you a little bit about our son's history and then talk about resources that I think are very helpful for brain tumor parents to know about. First, our son, Matthew, at 13 and a half, who was in the middle of 8th grade at the time, very healthy, active, soccer team, swim team, he all of a sudden started to complain of a headache. And we took him to the pediatrician 3 times in 10 days. On the last visit, the pediatrician finally decided something perhaps was truly wrong, did a neuro exam, didn't like what he saw, and sent us for an MRI, and picked up an image of a tumor in his pineal gland, and that night we were in the hospital. Matthew was diagnosed with something called an NGGCT, which stands for non-germinomatous germ cell tumor. It's a mixed germ cell tumor of the central nervous system. It's rare, it's very aggressive, in this case it was very aggressive, malignant tumor, and it requires multimodal therapy because it is composed of different types of tumor tissue. So first he underwent the standard protocol. He was put on a Children's Oncology Group protocol for germ cell tumors, and that included 6 cycles of chemotherapy, different combination of drugs alternating every 2 weeks. And then we thought he was all set to go and start to have radiation treatment, and unfortunately we saw some relapse before we could even begin radiation. So he was then to have 3 cycles of a salvage chemotherapy. And we also harvested his stem cells at the time, which turned out to be very fortuitous. Salvage chemotherapy, unfortunately, did not have a beneficial effect. So at that point, it was recommended that he have surgery to debulk the tumor. And then within a week after surgery, the surgery was very successful, thank goodness, we went up to Boston and we started proton beam radiation. At the time, there were only a couple centers in the country which were offering proton beam. 6 weeks of radiation, and then we came back and he underwent 2 rounds of high-dose chemotherapy with his own stem cell rescue. As I said, it was lucky that we had harvested his stem cells so that he could have those to recover from the high-dose chemo. So he completed treatment 13 months later, and it was a very difficult, frightening, stressful year for him, for our family, and the surprise was that after treatment ended, we had sort of another battle to deal with, and that was rehabilitating him. And he had, unfortunately, a very significant side effect of treatment, which was profound hearing loss. And so it was very challenging to try to figure out how to try to deal with that. Hearing aids were insufficient, and he was a candidate for cochlear implant surgery, fortunately. And so by the middle of 10th grade, he returned to school in 10th grade. He had missed half of 8th and all of 9th. Returned to school in 10th grade with hearing loss, but by the middle of 10th grade was able to have cochlear implant surgery, and that was just truly a lifesaver for him, a second lifesaver for him. And he was able to start to get his life on track academically and socially. And you can imagine how hard it is for any teenager to have that kind of setback in the middle of high school. So high school was pretty hard, and he needed a lot of therapy and rehabilitation, and we had speech and language therapy and academic tutoring and organizational tutoring and biofeedback and psychotherapy and counseling just to deal with the stress. And he, amazingly enough, graduated with his class, did a year of junior college, and then transferred to 4-year university and graduated this past May with honors in psychology and music. And I think we were probably the proudest parents at that graduation. With the time that I have left, I'd like to share what I sort of think of as my top 10 best list of advice for brain tumor parents. And I'll tell you that I actually did a little bit of research for this. I'm involved online with a group of brain tumor parents, and I put out a query to them and said, what would you tell parents who are going through this experience? What's your best advice? So I did a little bit of research. This is sort of their consensus, not scientific consensus, but I wanted to share what advice I heard and what advice I can contribute. And I also will be mentioning a number of organizations and online resources that I think are helpful to know about if you are taking care of a child with brain tumor. These organizations are going to appear in the text box. And then also, if you would like to have a list of them afterwards, I think they will be available by email by contacting either Deborah or Steve at National Brain Tumor Society. So first of all, I'm going to echo what Dr. Pomeroy just spoke about in his question, but make sure you're getting the best treatment possible. Make sure that you are being seen at a top children's hospital or a top research hospital that has expertise and knowledge in your child's type of brain tumor, and make sure that your attending physician is a neuro-oncologist. Usually if you present at a hospital that's a smaller hospital, you will be referred to a top research hospital, but it's just essential that you're being seen and being cared for by somebody who really understands your child's tumor type. Particularly in the case of ours, it's a very rare type of tumor. Number two, understand that you are your child's best advocate. And again, as Dr. Pomeroy said, it's okay, it's important, it's critical that you ask questions. It's okay to question a decision or a medical plan. Good communication with your medical team is absolutely essential. And you should never feel intimidated about talking to your child's doctor. And if he or she makes you feel intimidated, there's a problem. And it needs to be addressed at the start, because you are a party in your child's treatment, and you need to feel very comfortable. Number three, ask about fertility preservation options. Many, if not most, of the treatments our kids receive affect their future fertility, and it's very hard to deal with this at the same time that you're absorbing the information that your child has a brain tumor. And in the crisis of diagnosis, unfortunately, a lot of times fertility gets minimized in importance. But I can tell you that it is an issue that many patients and many families have regrets about later. And there's a wonderful resource called Live Strong Fertility, formerly Fertile Hope, that provides information and guidance and counseling to families and to young people with cancer. And so it's very, very important that you ask about fertility preservation. Number four, keep good records. The days are just going to start to blend together, the weeks and the months are going to blend together, and there's a lot to keep track of. So it's really helpful to set up a notebook with dividers and keep track of the blood work, the MRI reports, treatment details, notes about how your child is doing on a day-to-day basis, any questions that you have, notes that you might take while you're talking to your team. This information in one place will really serve you well as a resource, both while you're in treatment and afterwards to look back on. Number five, seek out information and guidance from other brain tumor parents. There's an amazing resource online called the PBT Yahoo group, Pediatric Brain Tumor Yahoo group. And it's a private, moderated, interactive online support group for parents of kids with all types of brain tumors. And all of the old conversations are archived and can be accessed. It's a group that you have to send an email to the moderator to join, but once you're admitted, you have literally hundreds of parents and families who can answer questions, let you know about resources, provide support. It was an absolute godsend for me. I didn't know a single family whose child had the type of tumor that my son had, and let alone somebody whose child had survived. I wanted to find one parent whose child had survived this into adulthood, and I found that family, and we are still in contact today. So that's a tremendous resource. There are also specialized brain tumor groups online. So I started a group online for parents of kids with germ cell tumors, the type of tumor my son had. And there are specialized groups for all different types of pediatric brain tumors. There's also the Children's Brain Tumor Foundation and the Pediatric Brain Tumor Foundation, and both of those organizations have great resources and information and can help you find other parents as well. Number six, accept help from family and friends. people are going to want to try to help, and it's important to say yes. You don't try to go through this alone. There's a fabulous website that we used called lotsofhelpinghands.org, and it allows you to create a calendar and to advertise help chores that you need help with, from meals to shopping to cooking to cleaning to rides, and it allows people to sign up for what they can do for you, and it allows like a whole community of people, your neighborhood or your church or your school, to help you, and it's a really, really wonderful way to take advantage of that help. There's another group I think called Take Them a Meal, which I've heard of as well. Number 7, take control of communications. Everybody's going to be calling you and emailing you and wanting to know the latest, and it's exhausting to try to keep up with those demands. So there's a wonderful website called Caring Bridge, and there's another called Care Pages, and both of those let you set up sort of a blog, a private blog that only your family and friends have access to. You authorize them to be able to access your page. And you can just post an update as often as you like, post photos, and you don't have to answer all the phone calls and answer all the emails, which, believe me, saves a lot of energy. Number 8, everyone in the family is going to need psychosocial support before, during, and after this is over. And this is a traumatic, difficult experience for everyone. And so, get help, whether it's talking to the hospital social worker or seeking counseling outside of the hospital, medication to help you sleep, medication to help you get through the MRIs, the anxiety of that, massage, visualization, whatever it is, take advantage of what help you can get and be proactive about asking for that help. And I would also tell you there's some incredible camps out there for your child, 2 that I happen to know of. Our Camp Make a Dream, which is a camp for cancer kids, but they have special weeks for brain tumor kids. Camp Sunshine is a camp in Maine, which has special weeks for brain tumor kids. There's a whole cancer camping association, which allows you can go online and you can find camps that are in your particular region. For teens, there are some wonderful groups. Teens Living with Cancer, TLC, Stupid Cancer, and the Ullman Cancer Fund for Young Adults all provide tremendous support for teens with cancer and young adults. For caregivers, there's a group called Immerman Angels. And as a parent caregiver, you can call them and you can be linked with a parent mentor who has been through a similar experience. Their child has had a similar or the same type of brain tumor, and they will just be a source of support by phone for you. And for siblings, don't forget the siblings. There's a group called Super Sibs. Our younger son had a very difficult time dealing with the year that his brother was in treatment, and he loved getting cards and packages from Super Sibs. They were small things, but they made a big difference for him. Couple more things. There are a lot of challenges that the brain tumor child faces after treatment, and the biggest probably is getting back on track in school. There's an amazing book called Educating the Child with Cancer, which has a special chapter on educating the child with a brain tumor. It's put out by the American Childhood Cancer Organization, and I think it's still available free upon request. And finally, one of the challenges my son faced is that his hair never did grow back. For a while, he wore hairpiece, and it was produced by an organization called Hair Club for Kids, which provides free hairpieces for children who suffer from diseases that lead to hair loss. So that's my top 10 list. I'm happy to answer other questions or even to respond to people individually. If you'd like to contact me after the chat, you can obtain my email address from National Brain Tumor Society.
In your mind, how important is it? Dr. Pomeroy had spoken about this, and it's definitely something I think all parents think about. And it's in terms of a second opinion. What advice do you give to parents who might feel uncomfortable about seeking a second opinion or just don't know how to go about getting one?
I was nodding my head the whole time Dr. Pomeroy was answering that question. I always advise families to seek second or even third or fourth opinions, particularly when the diagnosis is very rare. And there's in our case, our son fell off protocol pretty quickly. And so, our doctors were just going by their best judgment. But I thought it was important to know the best judgment of those clinician researchers in the country who were doing research on germ cell tumors. And so we were in touch with a number of those folks. And, it is very important to seek second opinion. Many times your own medical team will coordinate that for you. They will pull everything together for you and send the scans and send the history and bring back to you what the second opinion is, and so that you can have the benefit of that. You can also seek second opinion yourself by contacting, finding out who the experts are in the field and sending your child's information to them, and then hearing back or speaking with them directly. I think it's critical, and I think that you need to do that. You owe it to yourself for peace of mind.
When you were talking about your story, of course, talking to your son, and the communication of what you're having with your family, how did you broach that discussion with your 13-and-a-half-year-old, with diagnosis and starting to go through treatment? How did you talk about the decisions being made?
Yeah. Every child is different, obviously, and every family is different. In our case, the diagnosis was given to us in front of our child. Our pediatrician told him and me together in the same room that he had a brain tumor. So we started off from the very beginning being very honest and being very open with him. We felt he was of a maturity where he could handle that information. But I do feel that in most cases, honesty is a good policy. And of course, every family should get advice from their social worker and their doctor. But in our case, we told our son that this was the most difficult thing we would ever have to deal with as a family. And it was important that we needed to be honest with one another about everything. And we were. And I think he knew that we were not going to hold something back from him. And I think that brought trust in our family and gave him the peace of mind that he needed. It's not to say that I had to share every piece of information. He kind of gave us the signal that it was important to tell him what he needed to know, but he didn't necessarily need to know all the extras. And I think he trusted us to share with him as much information as he needed to have. But we never withheld anything that was important from him. We made sure that he felt that we were being very open with him.
Great. We're going to start opening this up. Of course, we have time for a few more questions, but before I do that, I was wondering if there are any last thoughts you'd like to impart at the end of this, Jamie.
Well, I guess I want to offer support to all families, any parents who are watching this who are in the midst of treatment with their child. It is a really, really rough experience, and no one would want to go through this, certainly, but there are really wonderful sources of support out there, and I've given you some of them, and I'm happy to try to help connect people with others. But just know that there really are a lot of parents out there who are willing to share their experience and their support. And I would also say that it's very empowering to get involved doing fundraising, doing advocacy when you have the time, when this is past you, feeling like you're taking a proactive role in trying to move the field forward, move research forward. That can be a very healing thing as well. So I wish everybody success and good outcomes for their children.